Everyone, and I'm really delighted to be here today, and thank you so much to the conference organizing committee to inviting me here, and also to Autism Speaks for sponsoring my being here. So I'd like to talk about ways to enhance the developmental trajectories of children with autism. And you will mostly know that, or most of you will know, I should say, that autism diagnoses are made on the basis of behavioral presentation and developmental history. And the prevalence of autism in Australia, which is where I come from Melbourne in the state of Victoria. And in Australia, we're talking now about the prevalence being between 1.5 to 2.5%, as indicated in a nationally representative sample. And approximately 50% of those meeting criteria for autism will have an intellectual disability. The onset of autism is variable over the first 2 years of life, so some children will show signs soon after birth, while others will develop typically, and then their development plateaus. Yet other babies will develop typically, but then lose skills that they have developed around 15 to 18 months, and other babies will regress even later. Now, the early signs of autism are very subtle, but can be used as markers to identify autism prospectively if you know what you are looking for. And diagnoses are possible from as early as 18 to 24 months, with high stability in early diagnosis. And in this paper, we found an 86% stability from diagnoses made at 2 to 4 years of age. Early identification and diagnosis, as you know, is critical because it enables access to early intervention. And we know early intervention can improve the outcomes of our children. We also know that parents' stress is high and their quality of life low in families affected with autism, not just in comparison to families of typically developing children, but to families of children with other developmental disabilities. And importantly, we also know that early identification and diagnosis can lead to a reduction in family stress and an increase in their well-being. So one way, of course, of promoting much more positive outcomes is by promoting early identification and diagnosis. And yet, the current age of diagnosis of autism in Australia is 49 months of age. This figure is based on government data from 15,000 children registered for access to services, and these children were under 7 years of age. So this age is really an underestimate because we know many children get diagnosed later than 7 years. In fact, many people get diagnosed only after their children receive a diagnosis, and they realize that they have faced the same issues, and we see many parents who are diagnosed with their children first having been diagnosed. So 49 months is really an underestimate. Indeed, in this work undertaken by my PhD student, Kathy Bent, where she worked with government data, we found that less than 20% of children are diagnosed with autism before 3 years of age, and less than 3% are diagnosed by 2 years of age. So we've been working very hard at our research center to try and change this. Most children are diagnosed and only have access to intervention for 1 year before they reach school, and we really know that we can do better. Dr. Josephine Barbaro at our center has been leading our work on early identification. And we use a developmental surveillance approach called social attention and communication surveillance, where over 2 large studies, we trained over 300 maternal and child health nurses on the early signs of autism and how to monitor babies as part of their routine checkups of children at 12, 18, and 24 months of age. So we're very lucky in the state in which I live, where we have a system of universal developmental surveillance conducted by highly trained maternal and child health nurses. And we train them on top of this to identify signs of autism in babies. So across 2 large studies, the first beginning with Josie's PhD, which was conducted between 2006 and 2008, we found a high positive predictive value where 81% of babies in study 1 and 82% of babies in study 2 referred by the maternal and child health nurses received a diagnosis by 24 months of age. And importantly, all children who did not have a diagnosis of autism either had a language or a developmental delay. So this meant that these children were also identified earlier than would otherwise have been the case. So in study 1, which we did between 2006 and 2008, 1% of the children monitored by the nurses were referred to us. And we had an estimated prevalence of autism in that sample of 0.84%. However, in the more recent study, 2% of children were identified as at risk and referred to us. And we had an estimated prevalence of 1.89% in this second study. So you can see here then, over time, we're seeing an increase in diagnosis of autism that we're seeing worldwide. Our data from the first study have been published, and these are the early signs that we used to identify children developing autism. So the signs we train the nurses to monitor at each age, 12, 18, and 24 months, are listed here. And you will notice 2 things. First of all, the signs in red, the items in red, are those that we use and we term as key signs. And to be referred as having a high likelihood of autism, the child has to fail 3 of the 5 items at each age. You can see that across each age, we monitor different items, and the key items are slightly different at each age. So for example, while imitation is highly indicative of autism at 12 months, it's not quite as predictive of autism at 18 and 24 months. At 18 and 24 months, pretend play and social smiling are much more predictive. So the idea here is that children with autism, like any child, develops. And so the items we use at each age are slightly different, and the key items that are highly predictive are also slightly different. And so when the child fails 3 of the 5 items, in our studies, they were referred to us, and we undertook a behavioral and developmental assessment and then sent them off to their pediatrician to confirm the diagnosis. So the figures I've been talking to you about are based on the confirmed diagnoses. Now, we've been following up the children that Josie Josie studied as part of the first study. And so another of my PhD students, Megan Clark, has been following these children up. So I mentioned earlier that we saw them to preschool age, where we found an 86% stability in autism diagnoses. By school age, we found that more children were no longer meeting criteria on the Autism Diagnostic and Observational Schedule, or the ADOS. So Megan followed this sample up when they were between 7 to 9 years. And the clearest finding here was that children over time increased in their cognitive ability, so that at 24 months, when they were diagnosed initially, we had 64% of children meeting criteria for an intellectual disability, meaning an IQ under 70. When we saw them at 48 months, only 40% were meeting criteria for an intellectual disability. And we were really quite amazed that at school age, we only found that 8% were meeting criteria for an intellectual disability. And you can see from this slide, I've divided it up into the verbal and non-verbal IQ. The light pink somehow left the slide. The key is the full-scale IQ, and you can see that increasing over time. And in particular, we see that it's really the verbal developmental abilities that are driving the increase in IQ over time. Megan also recruited a sample of children who were diagnosed between 3 to 5 years, so at a mean of 48 to 49 months. And we compared the outcomes at school age of the controls who had been diagnosed later to our sample who had been diagnosed by 24 months. And this is what we found. Again, it's to do with verbal DQ. So our group were doing much better in verbal DQ, and that was driving the difference in overall, or IQ, sorry, was driving the difference in overall IQ, where we found that the gains made by our children diagnosed early was much better than those diagnosed later. Moreover, the children diagnosed early more attend a mainstream school, fewer need ongoing support, and this is because those children who are identified and diagnosed early have earlier access to early intervention, significantly earlier access, and consequently have had more early intervention by the time they enroll in school. So these results keep us very committed to what we're doing. Clearly, if we can get in early and begin intervening at an age when language is still developing, we can really impact on children's development. So we're now working within a national cooperative research center, it's called the Autism CRC, to make sure that 50% of children in Australia are diagnosed by 24 months and 70% diagnosed by 36 months. And we are certainly achieving this at our site in Victoria. So it really is possible to make change. Social attention and communication surveillance really represents a new model by which we can build capacity in primary healthcare staff to identify children developing autism and to refer them for an earlier diagnosis. And we're currently taking a statewide implementation in Tasmania, which is the little island you see in the south of Australia. We've been undertaking this work internationally since 2011, and indeed, the SACS is now incorporated into the 7-year health plan in China's 4th largest city, which is a sister city to Melbourne, which is Tianjin. There are 100,000 babies born in Tianjin each year, and now they all receive developmental surveillance with the SACS incorporated. In all of Australia, we only have 300,000 babies born. There are several barriers, however, to early identification and diagnosis that need to be recognized. The first is awareness of early signs amongst parents and professionals alike. So this example from a pediatrician is not uncommon, where after we'd done our assessments and sent the child to the pediatrician, it's not uncommon to hear that this child is too young to diagnose with autism. We know this is not correct. A further significant issue is the waiting list for diagnosis. So even those children who are identified and referred in a timely manner end up aging while they're on waiting lists. And because of these long waiting lists, which run anywhere between 6 months to 18 months, which is a very long time in the life of a developing infant brain, the child and adolescent mental health teams where I live prioritize children in the year before school. Of course, this is understandable, but it's also ultimately detrimental to the children's outcomes. And what happens is that secondary manifestations begin to develop while the child awaits diagnosis. So we really need greater capacity to identify and diagnose these children earlier. And unfortunately, the number of children meeting criteria has increased. And why I say unfortunately is that while we have these increases in prevalence, they're matched by increases in the waiting time for diagnosis. And so sadly, in a first world country such as ours, we're seeing with the increase in the number of diagnoses over time, you can see the age of diagnosis is increasing over time, even though we know so much more about how to identify and diagnose children earlier. And so I can only imagine what it's like in low to middle income countries if in a first world country we're facing these issues. So in a country where we only have a population of 22 million, we still don't have enough capacity to identify, diagnose, and intervene in a timely fashion. So we still have a lot of work to do. And again, this is the work of the PhD student that I mentioned, Kathy Ben, where she used data from the government data over 2010 to 2015. So in an effort to make our work more scalable, and given we very well know that universal surveillance isn't as good in other places, we've teamed up with the 4th largest IT company in the world to develop a mobile app which is free, which is based on the signs that we use to train the maternal and child health nurses. And this app is designed for use by parents to monitor their children between 11 to 30 months of age. It's a video-guided tool, self-guided, using videos of the behaviors of interest in the child with and without autism. So parents view these videotapes and respond whether their child uses the behavior regularly or rarely. And if the child has a high likelihood of autism, the parent is alerted to this, and they're immediately sent a triggered email, and asked to print out the email with the items that have been passed and failed, and to take it to their medical professional for a formal diagnostic assessment. And we also have a purpose-built website that is used so parents can access further information. And if a child is not at risk, or even if the child is at risk, in 6 months' time, the phone alerts the parent to do the next assessment. So we take a developmental surveillance approach. I'm going to skip the next couple of slides where we won awards. And I guess I do want to, however, take some extra time to say that we know that autism impacts on the child's ability to learn, which can prevent that child from reaching their full potential. And if we can get in early, we are going to be able to allow these children to learn. So I am going to skip out on the later slides, but just to say that early identification and intervention not only has the potential to maximize the educational and developmental gains for the child, but it also improves long-term family functioning and well-being, which ultimately reaps long-term benefits for society. So the importance of public education around the early characteristics of autism cannot be underestimated, and that's why with the app we also want to raise awareness about early signs of autism. So please tell people about it so they can download the app for free and they can learn about what autism looks like between 11 to 30 months of age, which we then hope will increase the ability to diagnose these children much earlier. Thank you for your attention.